What's up, friends? Welcome back to KimmyDTV, a place where nurses and aspiring nurses come to achieve academic, career, and life success. I want to say, guys, happy new year. I know it's been such a long time since I uploaded. I've been so busy. I'm moving again. Oh my god. I know. Stay tuned to see where I will be moving to next. Okay, guys, a lot of changes going on. So the best time and the only way I can post and be consistent is if I just film on the go. So that's what I'm doing. Okay, guys, so I hope you guys are all sticking to your new year goals. If you have fallen off a bit, remember that you could always get back up again. It's in feeling bad, and you know, it's in feeling bad about making a mistake or not continuing is where the time is wasted. So if you have fallen off, remember, every single second, every single day is a new chance to get back on your 2022 goals. Okay, guys, so I wish you guys all good luck on achieving your 2022 goals. Okay, so this video is going to be pros and cons of working as a charge nurse in a psychiatric adolescent unit. Okay, so I want to preface this video by saying when I first interviewed for my first psychiatric position, the CNO asked me, well, you know, do you feel comfortable working with kids? And I initially thought to myself, a lot of people have told me before, including you guys, told me that I would work very well with adolescents. So I was thinking about that. I was like, maybe, but I never worked with adolescents. Remember, guys, I was an LPN before. For those guys who are new, I was an LPN before, and I mostly worked with geriatric patients, right? So this would be like totally new. And I also worked with pediatric patients, but those pediatric patients were like small babies in a home health care setting as an LPN. So I thought to myself, maybe I should still give it a try. So I said, okay, I'm gonna give it a try. And plus, I love the schedule that that unit was providing, which was like four days off back to back. Well, I could travel, I could do this, I could do that, I have freedom. So I said, of course, I'm gonna try my hand at adolescent girls unit. So the unit I was assigned was an adolescent girls unit. Okay, but sometimes I would be floated to the adult unit and the adolescent boys unit. So if you guys want me to make a separate video on pros and cons of working in a psychiatric regular adults unit, let me know and I will let you guys know. Okay, so but I mostly 96% of the time, 99.99% of the time work in the psychiatric girls unit. Okay, so this is what it's going to be about. So I would say the pros of working in a psychiatric girl. Let's start with the pros first. The pros, the number one pro of working in a psychiatric girls unit is the fact that, well, for me at least, the fact that it can be very rewarding. Okay, I am a young adult and I'm still navigating my way through life, but when I work in the psychiatric adolescent girls unit, I just feel like there is so much knowledge that I can, and advice that I can give to these young girls. Okay, and I think for me, I'm old enough to give that advice, but I'm young enough to remember how it was to be a teenager, because it was not that long ago. But at the same time, I have the experience and the knowledge and the know-how of an adult. So I'm kind of like in the middle. So these young girls, you know, and it touches my heart. A lot of them, they look up to me, and I work the day shift, by the way. They look up to me and they're always asking me for advice, and the parents love me. They're like, oh my gosh, like for example, if I'm discharging a patient, the parents are always like, oh my gosh, so-and-so loves you, Kimberly, and this and that, and when they're talking on the phone, like I would have parents say, wow, like I love that you spoke to her and stuff like this and stuff like that. I mean, granted, there are therapists in my unit, but you know, as nurses, we do have the responsibility of talking to the patients too, because you know, sometimes there's not enough time for therapists to have one-on-one conversation with every single patient every single second of the day. So that's when I step in. Of course, if I'm not bombarded with 7 admissions or 7 discharges that day, that's when I would step in and I would speak to the girls, and I would, you know, ask them about like what the main thing is. I would tell them about my story. Of course, I wouldn't be too personal. I wouldn't give too much information, but I would tell them, hey, I went through X, Y, and Z in life, and this is what I did. This is what I had a vision. One of the things I've learned in working in adolescent girls unit is to have patience. Guys, if you have kids, I don't have kids yet, but one thing I can say, even if you don't have children, if you're an older sister or an older auntie or whatever, ask them how their day is going. Because one thing I've learned is that some of these kids have gone through so much. Like, I think I gone through something that I can't even imagine going through, and they have already gone through it at 12, 13, 14. And by the way, that's the age group that's on the unit, is ages 12 to 17. So some of the things that these patients have gone through is so like life-changing, and it's so like it's just so horrific. And you know, it just really explains why certain, you know, young kids act the way they act. It's just like they don't have that some of them unfortunately don't have that support system. They don't have someone who's guiding them, or sometimes it could really be that they have a chemical imbalance in their brain or psychosis. And you know what, it's really, really sad to see young, beautiful little girls have these issues. And you know, I don't know, I can just relate, because I can relate in that when I was a teenager, like, I was very anxious, and it really came about in my early adulthood, when I was going through stuff as an LPN and stuff like that, that I really realized that, yeah, sometimes I can be super duper anxious. And for those guys who have been watching my channel for a while now, you guys will know that I since deleted the video, but now I feel confident enough to say it. Like, I did go through a panic attack one time when I was working as an LPN in a nursing home. So I know how it feels like to go through that, okay? So I know some people, they may not have panic disorder, they could have psychosis or stuff like that. But what I'm saying is, I help out where I can, and when I do my job, I do it with all my heart, because I've been through that. I was once a teenager, but nowadays it's 10 times worse, I feel like, because of the situation that's going on. Like, imagine, guys, imagine only having to go to school online. I mean, I liked it when I was in nursing school, but as a teenager, like, missing out on prom, senior trip, everybody wearing a mask, like, oh my god, I can't even imagine like going through that. That's horrible. I like that I got to wake up and go to school every day, even in the cold days of New York City. Like, I like that I was able to go to school every day, see my professors online, stay after school to go to tutoring for math because I wasn't good at math, seeing my friends, talking to them, not worrying about oh if the person accidentally spit on me or whatever, out of talking, you know, going to senior trip, prom. I'm so happy I got to have those experiences, and the fact that those things are limited to some of these patients or skewed is a big deal. It's really affecting the psyche of the kids, and also social media. So I'm a millennial, so I came in the advent of social media. So I do remember dial-up. Around when MySpace was popping, I was in like junior high. But when I was in high school, I don't remember Instagram being like that popping. It was still there, but it wasn't that popping. So, and even as a young adult, you know, sometimes you can compare yourself to others, because of social media can also be a good thing. It could be like you could get inspired, but kids mix that in with social media, mix with what's going on right now in the world, mix that in with hormones, and just, you know, when you're a teenager, what's the most important thing, right? To be liked by boys and to be like the most popular girl in school, like mean girl stuff. So mix that all in with low self-esteem and stuff going on at home and outside factors that they cannot control, and if they really do have a chemical imbalance in their brain, that's just a recipe for disaster, guys. So this is why these kids, ask them how they're doing. That's the number one tip I can give to those who are looking after young girls, 12, 17, whatever, even the boys. Ask them how they're doing. Ask them how their day is. Like, don't just say, oh, they're good. No, they're not. Like, they're young adults. So, like, I mean, there's only so much you can do. I think as a parent, I mean, I'm not a parent, but I'm just saying, as a parent, I feel like there's only so much you can do. At the end of the day, it's really up to God, and it's really up to how the kid is naturally. But ask them how they're doing, and just be involved in your child's life, because kids need guidance, okay? They're going to be the future of tomorrow, so they do matter, you know? And I love seeing them succeed, and I love seeing them when they first come in on admission, like they're a total mess, they're crying and this and that, and then when they get discharged, they're that much better. They can talk about their coping mechanisms, they can talk about their resources that they're going to use, and their outpatient follow-up appointments, and their therapies and stuff like that. And the fact that they can identify that makes me so happy, guys, because we have to take care of the younger people. We have to take care of the people who are coming behind us, because they are our future, okay, guys? So that's one thing I learned, is to just have patience with young people. Please have patience with them, because a lot of them are going through so much. So that's the number one thing I've learned, okay? So the pro is, so that's one thing, the pro, like you. And then another thing I realized about working in an adolescent psych unit is that, you know, it really challenged me to uncover any hidden insecurities, or, you know, and yeah, any unhidden insecurities that I may have about myself. Because if I'm sitting here telling a patient, a young girl, how to have self-esteem, how to not compare yourself to others, how to deal with stressors at home, how to deal with stressors in school, or blah blah blah, or productivity, then what about me? These kids are looking at me. These kids are looking at me as an example, okay? These kids are looking to me. So I have a responsibility of being a role model. And now that is a big responsibility, and I'm not saying I asked for it, because I know I'm a young adult still, and I'm still learning. Like, I feel like I'm still learning about life and stuff like that. I'm like, me? But believe it or not, they do look up to me. Like I said before, I'm in between that stage where I still remember how it is to be a teenager. I'm still young enough to remember how it is to be a teenager, but I'm still old enough to have that life adult experience of being an adult. So I'm right there in the middle, and I see them admiring me. I see them like, oh my gosh, oh, where'd you get your nails done? Your hair, you're this, you're that. Like, you know, because they always, teenagers, like, because their brain is not fully developed, they initially look at the outer appearance, and that's what they, I mean, that's a people too, but you know how they are. They're like, oh my god, this person, they look kind of young, you know. So they automatically gravitate towards me. I noticed that. So I use that as an opportunity to role model excellence to them, because that's what I want them to have. So so yeah, so I said, okay, yeah, this is where I get my nails done, but make sure that you get your treatment done, make sure that you're on top of your medication and this and that, so that you study hard and you work on yourself, so that one day you can have the money to get your nails done, you know what I mean? And I told them about goal setting and stuff like that. And yeah, and I remember I used to feel so bad when I couldn't get to a child, but I realized that some children I can get to and some children I can't. And I shouldn't beat myself up because I felt like this patient didn't really connect with me, guys. Guys, this job can be very rewarding. I've had patients write me, create letters for me, create cards, say thank you, Kimberly, this and that, and that really, really touches my heart. Like when the young girl's like, oh my gosh, Kimberly, you helped me get through this, and I really like how you explain this and that, and I'm like, really? And you know, just to sit down and have a talk with them is very rewarding, guys, because I'm the baby of the family. So, and I didn't really grow up with my extended family, so I'm not close with them. So to have a young person to mentor is very rewarding, you know, but it also puts pressure on me to do better in life, because if they are looking up to me, I have a responsibility. That means I can't be out here, you know, doing craziness or whatever. I have to really be a role model. So that really touches me in that way. So yeah, so it's a very inspiring job. You could be a role model. And yeah, it's like I do it with all my heart. I do it with all of my heart. Okay, and even with the boys, it helps me understand like male psychology when they're little boys. Like, you know, it really helps me understand. I'm like, oh wow, like that's how they think. And a lot of the boys too, like, you know, they need somebody to listen to too. Like I can't give advice in a perspective of a man, because I'm not a man, but I can also provide that listening ear and my advice and just, you know, just advice in that way. Okay, I think for my male nurses out there, if you're thinking about psych, think about the adolescent boys unit, and that could be a great way to give back, because I feel like I just feel like they could better relate to a man, you know, because that's what they're going to be when they grow up. But yeah, that's also rewarding too. The cons. Oh my goodness. Okay, the cons. The cons are when you're working on a kids unit, it can be so crazy, like 10 times more crazy than working on an adult unit, because like I said, the emotions, this and that. Fights can happen, and they happen a lot, because you put a bunch of girls, a bunch of pubescent girls in one place. I mean, I went to Clara Barry High School in Brooklyn, New York, and there was fights almost every single day. And of course, me being a nerd with my glasses and my big book bag, I was always like, I'm scared. But it kind of took me back to that place. Like, I was like, what? So there could be fights that happen, and you're expected to help separate the fights and call the code green to help so that other people can come in. So that can be very stressful, because once that occurs, you have to call the parents, you have to do a bunch of paperwork, you have to do an incident report and stuff like that. Another thing is that in the kids unit, I also find that there is more of a chance of patients acting out to the point where they may get a shot. Okay, so when a patient gets a shot, so you know, sometimes you have to call the code again. There's a lot of paperwork. You have to call the parents. So that's a very stressful to me, because I feel like, you know, who wants to go to work and then see people fighting, right? So that's a con. Like, you just got to separate them. So that's why it's so important that as a charge nurse especially, that you pay attention to your minute, okay? If you notice a patient is having increased anxiety, like that's why it's so important to get your paperwork, get all your little paperwork, all the miscellaneous things out the way in the beginning of your shift, because you have to have a watchful eye. If you're truly watching your Milu is basically your environment, your setting, and you notice a patient, this patient is having increased anxiety, or these two patients could be talking very well, and then one person says something and then it escalates. If you notice any escalation, just separate them. That's my technique. Just separate them. Be like, okay, let's separate and let's let you guys cool off. Yes, they can talk it out too, but if they are too agitated, then you need to separate them, okay? In that unit, the girls unit, we have a door that you can close, and well, in every unit, and you can separate patients, okay? So just separate them. If you notice a patient is getting increasingly anxious, okay, they're pacing, whatever, you know, you try the verbal de-escalation. If that doesn't work, you know, you ask, do you want your PRN? Okay, be proactive, because if you're not proactive and you're not noticing things, then that's when things pop off. So just ask the person, like, hey, would you like your PRN? If you're being very anxious, if they say yes, then they can get their PRN, okay? So the whole point, and then also if you talk to the patient during the day, there's less chances of them fighting because they feel like they're being heard. But if some of the patients, they could be like that. If they feel like, you know, you're not really paying attention, and nobody's paying attention to them and nobody cares, they may find other ways to get attention, okay? Not only teenagers, adults do that too, but teenagers do that to an extreme, okay? We all know that, okay? So yeah, guys. So that's what that, okay? Let's say another con. Yeah, I would say that's the number one con, is just the fighting and, you know, the possible, yeah, just the fighting and you know, just the cattiness, you know. A lot, you know, when it comes to teenage girls, there's always, oh, he said, she said this, she said that, you know, and then, I mean, it just brings you back to high school. And to be quite honest with you guys, one thing I've learned is that I like my adult life 10 times better than being a teenager. Yes, being a teenager has its perks because you don't have to worry about paying bills. You don't have to worry about, you know, you don't have to worry about paying bills or doing this, doing that. Like, you don't have a lot of responsibility. You just have to worry about school. But to me, as an adult, I like being an adult. I don't care about, I mean, yeah, it could be stressful because you're responsible for your bills and this and that. You're responsible for your life, but I'd rather that than being a teenager again, because when you're a teenager, you have to deal with like pettiness, like people don't like you, and you still have to go to the same high school, and you still have to go to the same small class, and it's like this, it's like that. It could be like, kids can be very, very mean. Now in the real adult life, adults can be very, very mean, but you have more control over your environment. You have more control over who you're surrounded by, who you're this, who you're that. Like, I don't know, I just feel like with the adult world, you have more autonomy. You can choose your environment. You can choose who you talk to. You know, it's not the same. You know, it's not the same at all. Alright guys, so that's a quick video I wanted to make, guys. Pros and cons of working in an adolescent psych unit. I hope you guys really enjoy.